It's a great honor to tell you about risk factors of neonatal seizures in very low birth weight infants in a nationwide cohort. We aimed to assess the risk factors of neonatal seizures requiring anti-epileptic medications in NICU admissions among very low birth weight infants. A total of 16,279 very low birth weight infants born from 2013 to 2020 were included in our analysis using the Korean Neonatal Network data. Multivariable logistic regression analysis with the backward elimination method was done to assess the risk factors of neonatal seizures, adjusting for perinatal and neonatal factors. Also, a subgroup analysis was conducted by categorizing infants into two groups based on the gestation age at birth, less than 28 weeks and 28 to 36 weeks. Among the 16,279 very low birth weight infants, 1,430 infants, 8.8%, had neonatal seizures. When we compared the perinatal and neonatal characteristics according to the presence of neonatal seizures, gestation age at birth and birth weight were lower in infants with neonatal seizures. The proportion of male gender and congenital anomalies were also higher in infants with neonatal seizures. Infants in the gestation group less than 28 weeks showed no significant difference in the proportion of congenital anomalies according to the presence of neonatal seizures. The 28 to 36 week gestation age group showed no significant difference in the proportion of male gender. We performed multivariable logistic regression analysis with the backward elimination method to assess the risk factors of neonatal seizures, adjusting for gestation age at birth, male gender, small for gestation age, congenital anomaly, cesarean section, delivery room resuscitation, antenatal steroid use, inborn, gestational diabetes, pregnancy-induced hypertension, histologic chorioamnionitis, surfactant use, patent ductus arteriosus requiring treatment, hypotension within the first week of life, intraventricular hemorrhage more than grade 3, post-hemorrhagic hydrocephalus, sepsis within 14 days after birth, meningitis, and necrotizing enterocolitis more than stage 2. Higher gestation age at birth, antenatal steroid use, inborn delivery, and patent ductus arteriosus lower the risk of neonatal seizures. However, male gender, congenital anomaly, small for gestational age, delivery room resuscitation, histologic chorioamnionitis, surfactant use, hypotension within the first week, severe interventricular hemorrhage, post-hemorrhagic hydrocephalus, sepsis within 14 days after birth, meningitis, and necrotizing enterocolitis were significant risk factors of neonatal seizures. When we performed subgroup analysis, lower gestation age and male gender were significant risk factors only in the less than 28 weeks gestation age group, and congenital anomaly was a significant risk factor only in the 28 to 36 weeks gestation age group. In conclusion, development of neonatal seizures was more dependent on neonatal morbidities rather than gestation age at birth in preterm infants with more than 28 weeks of gestation. Providing effective treatment in NICUs could prevent the development of neonatal seizures in very low birth weight infants, especially with a higher gestation age at birth. Thank you for listening.